Caring for a cat with food poisoning, a comprehensive guide. Introduction. Food poisoning in cats can be a distressing and potentially serious health issue. As responsible pet owners, it is our duty to take all necessary measures to ensure our furry friends' well-being. In this article, we will discuss how to care for a cat with food poisoning, including identifying the symptoms, providing immediate aid, consulting a veterinarian, and preventing future episodes. Understanding food poisoning in cats. Food poisoning occurs when cats ingest contaminated or spoiled food. Cats are particularly sensitive to certain ingredients and bacteria that can lead to gastrointestinal upset, vomiting, diarrhea, and other related symptoms. Some common causes of food poisoning in cats include bacteria such as Salmonella and Campylobacter, ingestion of toxins, or feeding them human foods that are toxic to cats. Identifying the symptoms of food poisoning. Recognizing the symptoms of food poisoning in your cat is crucial for providing the necessary care promptly. Some common signs of food poisoning in cats include vomiting, diarrhea, loss of appetite, lethargy, abdominal pain, dehydration, and sometimes fever. If you notice any of these symptoms, it is essential to act promptly to minimize discomfort and prevent complications. Providing immediate aid. When you suspect your cat has food poisoning, there are a few steps you can take to provide immediate aid before seeking professional help. Firstly, remove any remaining food and water to prevent further ingestion of contaminated substances. Next, gently clean the cat's mouth and paws to remove any traces of the toxic substance. If the poisoning is due to ingestion of a toxin, consult a pet poison helpline or veterinarian for specific instructions. Consulting a veterinarian. Seeking veterinary assistance is crucial when dealing with food poisoning in cats. A veterinarian will be able to assess the severity of the situation and provide appropriate treatment options. They may ask for details about the cat's recent diet, perform a physical examination, conduct laboratory tests, or recommend further diagnostic procedures to establish the cause of food poisoning. Depending on the cat's condition, they may administer fluids to prevent dehydration, prescribe medication to control vomiting or diarrhea, or suggest dietary changes. Dietary changes. Following a bout of food poisoning, it is important to make dietary adjustments to aid in your cat's recovery. Your veterinarian may recommend a bland diet consisting of easily digestible foods such as boiled chicken or fish mixed with plain white rice. Avoid offering any processed or seasoned foods that may irritate the cat's digestive system. Gradually reintroduce their regular diet over time, under the guidance of your veterinarian. Preventing future episodes. Once your cat has recovered from food poisoning, taking preventive measures is crucial to avoid future episodes. Here are some tips to prevent food poisoning in cats. 1. Provide a balanced and nutritionally complete cat food diet. 2. Avoid offering toxic human foods such as onions, garlic, chocolate, grapes, raisins, and certain artificial sweeteners. 3. Store cat food properly to prevent contamination and spoilage. 4. Avoid sudden changes in diet, as they can upset the cat's digestive system. 5. Practice proper hygiene, such as washing hands before preparing meals and cleaning food bowls regularly. 6. Be cautious of feeding raw or undercooked meat, as they may contain harmful bacteria. 7. Keep garbage and other potential sources of toxic substances out of reach. 8. Regularly inspect cat toys, bedding, and other items they come into contact with for any signs of contamination. Conclusion. Caring for a cat with food poisoning requires prompt action, proper diagnosis, and appropriate treatment. By being attentive to your cat's symptoms, providing immediate aid, consulting a veterinarian, making dietary adjustments, and taking preventive measures, you can ensure their health and well-being. Remember, prevention is always better than cure, so it is essential to be proactive in providing a safe and nourishing environment for your beloved feline companion.